Parliament debated the budget for 3 ministries today: the Environment and Water Resources, Health and Transport Ministries. Many MPs rose to support the call for the government to be more inclusive in its policies, specifically on the issue of healthcare. Many said there was a need to make healthcare more affordable and accessible for Singaporeans.
Inpatient hospital expenses are reasonably covered by the 3Ms framework. Many Singaporeans are still concerned about this expense despite the heavy subsidies already provided for primary and specialist outpatient care. By further extending the use of MediSave, we can encourage better patient compliance with respect to management of these diseases, thereby improving outcomes and reducing chronicity and disability.
There is an administrative fee chargeable on MediSave deduction transactions. While the fee may appear modest, it can add up to quite a sum if a senior has to go for several medical appointments.
The mechanism for referral to subsidised specialist healthcare in the government restructured hospital can be improved. If a patient sees his GP and is deemed to need a specialist consultation at the government restructured hospital, he will not be considered a subsidised patient by the specialist clinic of the hospital on the basis of his GP's referral. To qualify for subsidised outpatient specialist care, he has to make a trip to the polyclinic, wait many hours to see the polyclinic doctor, and pay for his additional consultation in order to get a referral letter that allows him to be seen as a subsidised outpatient at the hospital. Such a cumbersome referral system increases both direct and indirect healthcare costs.
Participating GPs can already refer charged patients to public sector specialist outpatient clinics at subsidised rates, as Ms. Tim Pei Ling and Mr. Lui Tuck Yew asked about. They do not need to visit a polyclinic.
Mr. Gan said the government is undertaking a review of Singapore's healthcare financing system. He said the review will be extensive and will involve fundamental shifts and is expected to take more than a year. One of the fundamental shifts, the Health Ministry will take on a greater share of national spending, up from the current 1/3 to about 40%. Mr. Gan said this could possibly go even further, depending on various factors like demographics and the ability to manage healthcare costs and target subsidies. He added this will help reduce the impact of rising healthcare costs, especially for lower and middle-income Singaporeans.
How we spend the additional money is also crucial. Today, the bulk of our subsidies go towards hospitals where the cost per episode is high. And as our population ages, delivery of healthcare will increasingly extend beyond hospitals. Many Singaporeans, including Dr. Chia Shi Lu, have given feedback on the cost of outpatient care. We have enhanced CHAS to make primary care at GP clinics more affordable and raised subsidies for drugs to help lower and middle-income patients. In our review, we will explore how we can provide more financial support in a targeted way for specialist outpatient care, primary care, preventive health care, dialysis, and long-term care to reduce the share the patients have to bear.
The second major shift is on MediSave. Mr. Gan said the ministry will review MediSave policies to see how to have greater flexibility in the use of MediSave.
We raised the cap on use of MediSave for chronic diseases from $300 to $400 last year. Can we raise it further? Should we extend chronic disease management program to include more diseases, as some MPs suggested? Or should we allow MediSave to be used for outpatient treatments beyond the CDMP? How do we prioritize the different needs to ensure that MediSave will not be depleted prematurely? How do we ensure that providers focus on the necessary and cost-effective treatments so that each MediSave dollar is well spent? These are issues that need to be addressed in the review.
The third shift is on the role of insurance. The government recently enhanced MediShield to include congenital and neonatal conditions and gave each Singaporean baby $3,000 in his own MediSave account. Mr. Gan said this is a significant step towards making MediShield coverage universal for the younger generation. He added his ministry will next need to look into how to help older Singaporeans stay insured under MediShield.
MediShield is designed to be a catastrophic insurance, primarily for larger inpatient bills. As we review how we can strengthen insurance coverage, we will also examine whether it should remain so, or if we can expand it so that it can offset a higher proportion of costs while keeping premiums affordable. We will also have to address Singaporeans' concerns about exceptionally large bills that go beyond the current cap of MediShield claims.
Mr Gan said the major review of Singapore's financing framework initiated last year will take some time, but a few immediate changes to keep healthcare affordable will be made. For one, Mr Gan said the Ministry of Finance will be topping up the Medifund capital sum by $1 billion.
From 1st April 2013, we will extend Medifund assistance to patients at the National Dental Centre. In addition, Singaporean mothers who face difficulty paying for their antenatal care and delivery can also be assisted by Medifund. By June 2013, we will also extend Medifund to the polyclinics, including dental services there. This will provide some relief for needy patients.
More drugs will also be subsidised and is expected to cost the government $5 million a year. The Health Ministry says it will also absorb the fee of about $3 that is charged to institutions for each Medisave claim that patients make from 1st April. Now, infrastructure for healthcare will also be enhanced. There will be 4,100 more acute and community hospital beds by 2020. And beyond 2020, the ministry is planning to build 4 new acute hospitals in areas where demand is likely to grow. Primary care facilities will be stepped up too. Mr Gan said the plan is to build 4 new polyclinics by 2020 and another 6 to 8 more by 2030. As for the healthcare workforce, the ministry is increasing health institutions' training capacity with a $50 million boost this year. It has also launched a new branding campaign for nursing and allied health jobs.
In the past year, our healthcare professional workforce grew by 3,700, or about 8%. We are on track to growing our professional workforce to meet the healthcare needs of our population as outlined in Healthcare 2020. Our priority continues to be to grow our local healthcare manpower supply.
Amidst Singapore's ageing population, the focus will be on the elderly. An enhanced set of nursing home licensing standards will be introduced by 2015. Minister of State for Health, Dr. Amy Khor, says an industry-led committee will be reviewing standards and identifying areas that can be enhanced. These include oral hygiene, continence management and falls prevention, as well as caring for the emotional well-being of the seniors. The Health Ministry is also engaging Singaporeans to remake nursing homes. It is tapping on architects' creativity to build nursing homes that are not just clinical care facilities, but modern homes for seniors to recuperate. For new nursing homes, the government is planning to design them to be aesthetically pleasing yet functional.
An example is the future nursing home in Jurong East. Instead of a squarish residential block, the architect breaks up the messing to create a more interesting form. Green balconies are injected in between the towers, making the whole development more visually pleasing to the surrounding community. This will not look out of place within a residential area. Beyond the hardware, we are evolving our nursing homes to be elder care hubs that can benefit a wider community of seniors and their caregivers. Where space allows, we will expand their suite of services beyond nursing home care to include daycare and other services for caregivers.
But Dr. Khor acknowledged that some seniors prefer to be cared for outside of the nursing home. So the Health Ministry will step up its efforts to develop home care services to support caregivers. It will be convening an industry-led committee to review and chart new standards and strategies for home care development. The committee will recommend a common system to assess the care needs of home care patients, set common standards of home care, and identify new home care services that can be developed. The application process for subsidies will also be simplified. Under enhancements to the Seniors Mobility and Enabling Fund, any senior living in a 3-room flat or smaller will automatically qualify for 90% subsidy for devices that cost less than $350.
When the changes take effect from the 3rd quarter of this year, we believe that the enhanced SMF can benefit caregivers like Ms. Masni binti Jaffa. Ms. Masni and her husband not only have to support 6 children, but also need to care for her elderly parents. Her father suffered a stroke a few years back and is now bedbound, while her mother suffers from diabetes and kidney failure. Both her parents are receiving home nursing services from Touch Home Care and require consumables such as diapers, milk feed, and dressings. With the enhanced SMF, they will receive 80% subsidies on the cost of consumables, saving up to $4,000 a year.
The government is also aiming to improve the health and well-being of Singaporeans through effective health promotion policies. To that effect, it is coming up with a Healthy Living Master Plan. It will focus on 3 Ps: place, people and price. The place element includes healthier hawker centres, which will be extended to 40 more hawker centres, food courts and coffee shops this year. The people element is about reaching out to all segments of society and improving health literacy. The price element aims to make healthy living affordable, and this includes improving the affordability of health screening.
Our purpose is to ensure that no Singaporean is deprived of a healthy lifestyle. To achieve this, it means first that the right environment needs to be developed throughout Singapore so that leading a healthy lifestyle is not just easy, but natural for all of us. Secondly, everyone is actively engaged and aware of opportunities for leading healthy lifestyles. Last but not least, adopting a healthy lifestyle need not be the more expensive option.
The Health Promotion Board is also addressing the need for more affordable, healthier food options.
HPB has worked with the ingredient suppliers and stall vendors in the Healthier Hawker Centre program to make sure the healthier dishes offered are affordable. HPB also partners major supermarket chains to offer regular promotions of healthier products at discounted prices. We are also working with local R&D institutions and the food industry to build capacity to produce affordable and healthier foods and beverages.
Now, moving to the issue of ensuring infrastructure is built adequately and ahead of time, the Minister for the Environment and Water Resources has outlined the Public Utilities Board's plans to develop the ABC Waters Programme further. It has identified 100 more sites for the programme. ABC Waters integrates drains, canals and reservoirs with the surrounding environment to create water parks and community spaces.
We will make sure that we will interconnect these ABC, what I call blue ribbons of water, with the National Green Park Connector Network, so that you will be able to have access throughout the island. You can run many marathons along these routes. We have completed 20 projects so far, but the good news is that, in fact, we have identified about 100 sites that could potentially be developed over the next 15 to 20 years. Now, I'm not saying we can do all 100. But I'm saying that there is potential to do many more sites.
He also assured Singaporeans that the country will have enough water for everyone.
Today we have the 4 national taps, and we are in a secure position. I can give assurance to this House, we will certainly be water independent well before the expiry of the last agreement with Malaysia. I can even go further than that and assure Ms. Faizal Jama that, in fact, water is not going to be the limiting factor. You can produce as many babies as you like, you can build as many houses as you like, water will not be the limiting factor. We can continue to produce more than enough water for Singapore for the long-term future.
Singaporeans too have a part to play in building a sustainable country, and the Second Minister for Environment and Water Resources, Grace Fu, says keeping it clean is not just a job for the cleaners. As such, the government is considering harsher penalties for litterbugs. The maximum fine for recalcitrant offenders may be raised to $10,000, up from the current $1,000. Ms. Fu said the National Environment Ministry will increase enforcement hours by about 50%. More plainclothes officers will also be deployed at littering hotspots. However, Ms. Fu stressed the enforcement and penalty system is only one part of the solution.
We need the public support for more effective surveillance, enforcement and deterrence. Through greater community involvement, we can build a strong sense of social pressure against littering. Through effective and enhanced enforcement, we can send a strong signal that it is better to dispose your litter properly. In short, we will not tolerate littering and cannot rely solely on cleaners to keep Singapore clean. We need everyone to help us make the transition from being a clean city to a clean one.
And the Environment Minister believes the most sustainable way of life for human beings was actually a very dense but well-planned city. He said Singapore can be the model for that way of living in the future.
Many people think being green means living in a rural area. But if you stop to think about it, living in a dense city is the cheapest way of providing food, water, healthcare, education, jobs, entertainment, ideas, and cultural exchange, simply because you have to move around less. So in fact, the future for humankind, we now have 7 billion people, more than half of people live in cities. By the turn of the century, 80% of us will live in cities. A dense, well-planned, connected city is the greenest and most sustainable way of life for the future. And Singapore can take the lead. One key unique feature about Singapore, if you fly over Singapore, is that a lot of it is green. Almost 47% of Singapore is green. But why is it green? It is green paradoxically because we are so high-rise, because nearly 90% of us live in apartments. The point I'm trying to make is that if you really think about sustainability in the long run, the answer lies here. And in Singapore, we are building a working model of the future.
Next, the issue of transport. Various MPs wanted to know how travelling for commuters will be made more pleasant.
The Bus Enhancement Programme 2012, with 780 weekly bus trips, has not made any impact upon commuters. Will the additional 800 new buses announced to be able to make a difference? How soon will the new buses be operational?
Fare concessions for the disabled are a commonly implemented practice in many other countries. It is simple and compassionate, and the government would do well to demonstrate its inclusivity by implementing such a concessionary scheme for the welfare of Singapore's disabled community, our community.
Poly students should enjoy the same concession as junior colleges students do. Refusing to grant polytechnic students the concession is an anomaly which should be corrected. Sympathetic alone is not sufficient.
To meet demand, the Transport Ministry will focus on increasing capacity. Starting with buses, 19 new public buses have been added to the roads in the 5 months since the Bus Service Enhancement Programme, or BSEP, launched. Transport Minister Lui Tuck Yew said this has added 5 new bus routes and improved about 50 existing services. More than half of the 550 buses committed by the government are expected to be delivered by the end of the year.
Given the progress that we have been able to make so far, we will try to complete the bulk of the BSEP service improvements by the end of 2014 instead of 2016 as we originally envisaged. Of course, this is contingent on SBST and SMRT being able to raise salaries and recruit as well as retain enough bus drivers in a tightening labour market. But I think that with some effort on all sides, we can do it.
Private bus operators will also be roped in to provide more bus routes. Mr Lui said 6 more City Direct bus services will be contracted out to private operators and rolled out as soon as early next year. The new services will connect towns like Ang Mo Kio and Bedok to the city in the morning and evening peak hours.
We will work also with the private operators to see if it is possible for them to run other shorter services during peak hours, such as localized routes in estates that bring residents to the MRT stations. We intend to invite tenders for these short services from the 3rd quarter of this year and to implement them progressively from next year onwards, provided the response from these private operators are good. Such services will add to the existing bus feeders already run by the PTOs and help us to more quickly address the problem of crowded feeder services during peak periods.
Train frequencies will also be improved. Commuters travelling outside peak periods will not need to wait more than 5 minutes for the next train. And during the shoulder peak periods, the aim is to bring down the average waiting time to about 3 minutes. Mr Lui said all the improvements will require train operators to run about 10% more trips. Commuters on the north-south and east-west lines will benefit starting from the second half of this year. Those on the north-east and circle lines will benefit when new trains are delivered from 2015. A target has also been set to reduce the number of faulty trains pulled out of service to about 2.1 per 100,000 train kilometres this year.
We will intend to increase train capacity over the next 5 years as we receive new trains and complete the re-signalling in phases from 2016. SMRT has also shared with us their plans to buy another 6 trains on top of the 13 that is coming in next year and the 22 trains that were coming in 2016. So 6 more trains on top of those already announced plans. And this will increase the train fleet that we have today by about 30%. The train fleets for the North East Line and the Circle Line will increase by about 70% and 60% respectively in 2015 when the trains that we ordered last year will be delivered.
Waiting times on the road will also be addressed. Buses will be made more reliable. $50 million will be spent over the next 2 years to give buses more priority on the road.
We will add about 30 kilometres more of bus lanes, increase the mandatory give way to buses scheme by another 150 bus stops, and quadruple the number of bus hubs where several buses can come in and pick up passengers or discharge them all at the same time. And currently we have about 10 and we will quadruple that to about 40. We will also have to step up enforcement of bus priority schemes as infringements by motorists result in delays for buses and their commuters.
Finally, demand will be managed, and Mr Lui says the government is prepared to significantly increase its incentives to encourage travellers to shift their travel to off-peak periods if they are able to do so. This is especially since shifting the peak hour demand into the pre-peak period will benefit both pre-peak and peak hour commuters. Mr Lui said if 10 to 15% of commuters shift their travel up to an hour earlier, there would be a perceptible improvement in commuters' daily travel experience to work. Mr Lui also responded to an idea mooted by MP for Pasir Ris Punggol GRC Dr Janil Puthucheary to allow free travel for commuters before peak hours.
Over the past week, there's been a lot of discussion on Dr Janil's idea to allow commuters to travel free on public transport before the peak hours. Many other members like Mr Liang Eng Hua, Dr. Lee Bee Hua, Mr. Cedric Foo have chimed in support of his idea. And certainly this is an idea that we will not dismiss offhand, and I've asked my staff to consider it seriously. What we are still studying is whether we should simply increase the current 50-cent discount substantially to say $1, or to go all the way to make it free for commuters travelling before a certain cut-off time in the morning. Rest assured that we certainly want to do more to encourage more commuters to shift out of the peak hour.
Finally, briefly addressing the issue of jobs, specifically that of cleaners, the Second Minister for Environment and Water Resources, Grace Fu, says the ministry is ready to table a bill later this year to introduce the mandatory licensing of all cleaning companies in 2014. Ms Fu said this will set the standards that all cleaning companies must meet before they can operate. She added that the government is trying to transform the cleaning industry. By improving the productivity and standards of the industry, the ministry hopes to uplift the jobs of 50,000 resident cleaners.
Mr Zainal Sapari and Minister Lim Swee Say have called for licensing to hasten the pace of change during the budget debate. This will set the standards that all cleaning companies must meet before they can operate. The key licensing requirements include mandatory training courses and progressive wage model for the cleaners. With better training and employment conditions, our cleaners can look forward to better lives.
Join me for another session of In Parliament tomorrow.